Hi everyone, welcome to Lab 5, Muscles of the Trunk and Thigh. Because this lab kind of bounces all over the place, I decided to go into the whole body section of real time. You can certainly go between each section, but this one crosses, I think, 4 different ones. So I highly recommend going into whole body in the 3D real time. So we're going to start right at the top, and I've selected this view. Let's get rid of all the vessels, which we will learn a little later. There we go. So up here, we only have one muscle we're going to be looking at, and that's sternocleidomastoid. Okay, so sternocleidomastoid gets its name from its location. So sterno, because it's attaching here to the manubrium, cleido, because of its attachment on the clavicle, and mastoid, because it goes up and attaches to the mastoid process of the temporal bone. And you'll notice it also goes back onto the occipital bone. Okay, and you have one on this side as well. And we're already leaving this view, and we're going to go into, there we go, our main postural muscles, which are the erector spinae muscles. Okay, the erector spinae muscles are composed of 3 groups of muscles, and you're going to have the same thing on each side. Okay, so centrally, you have the spinalis muscles. As you move outwards a little more, you have longissimus, there and there. And then as you move further out, you have iliocostalis, okay? And costal means rib, so that's how you can remember this is the most lateral one, the one that's connecting to all the ribs here. So that's iliocostalis. You'll notice in the name, it says iliocostalis lumborum. And let's use this one as our example. So longissimus has thoracis. See that, longissimus thoracis. And as we move further up, they may change names to be like cervicis, meaning now you're in the cervical region, thoracis meaning you're in the thoracic region, lumbar meaning it came from the lumbar region. We are not concerned about this in this course, okay? Those additional terms just tell you which area of the muscle you're at. But for our purposes, just spinalis, longissimus, and iliocostalis are all that you need. So erector spinae is the name of the group, but if we label these on a test, we will label one specific muscle. So we will label iliocostalis, longissimus, or spinalis, and you need to be that specific to get the marks. Okay. Nope, we're gonna switch views. Yep, we need to switch a little more. Okay, so let's go down to the abdomen. And we will start right there. All right, let's zoom out a bit. So now we're moving down to the abdomen. Oops, not that far. Okay, I know I have to get my cursor away from it. There we go. And let's close it so I'm no longer tempted. All right, so most externally, once you remove the skin and fat, you are looking at the external obliques, okay? And you can see if we turn around a little bit, that our external obliques are what I call front pocket muscles. So if your hands follow this path of the fibers, you'd be putting your hands in your front pockets. You can see them attaching to the ribs here, and then to a very large, broad aponeurosis on the front, okay? And now we're going to get rid of oblique. And we have a few more things here. All right, so we'll get rid of all of that. And now we are at the next level down, which is the internal oblique. So I want you to notice the direction of the fibers here, because that is a great way to know what you are looking at. So the external oblique fibers went downward. These ones go up, okay? So they're gonna be pointing upwards like this. And I sometimes call these my back pocket muscles. So if your hands were to follow the path, you'd be putting them in your back pockets. Okay, so you can see the muscle fibers attaching posteriorly along the ribs and specifically along the hip bones. Okay, and then they're going to come forward to attach on the large aponeurosis in the front, which is just a large, broad tendon. All right. Let's get rid of all those things. All right, so this one you should probably recognize. These are our rectus abdominis muscles, okay? And you can see that they are very distinct in that the bands of muscle are separated by these tendinous intersections. So if these muscles are quite strong and you use them often, you can see the distinction of those tendinous intersections through your skin. That's how you get your six-pack. Or if you're really good, an 8-pack, because you can see that there are 4 segments on each side. And those are running, connecting up here to the costal cartilages and the ribs, and then running right down to the pelvic bones inferiorly. All right, let's get rid of those. And I see I've gotten rid of something here. So what we're left with here underneath all of those muscles is the transverse abdominis muscle. So this is a muscle that when it contracts, it's really going to solidify that core and really push in on all the contents. And there should be a little more muscle here. Whoops, that's too much muscle. Let's just pick out the ones we want. Transverse abdominis. There we go. And there. Okay. So it's going to look like this. So just like the obliques, we're going to have the central, very large tendinous sheath called the aponeurosis. And then you have your muscle fibers here. Transverse abdominis fibers are horizontal, okay? So the external oblique muscles ran downward like this. The internal oblique muscles ran up like this. And the transverse abdominis is straight across. When you do planks in a workout, you're really working hard on this particular muscle. And while you can't see it, it does allow, working it does allow the rest of your musculature to be a little more nice and look a little better on top of it. All right, where am I going next? Okay, let's go to the intercostals and the diaphragm. Okay, there we go. All right, so if we move back up to the thorax, we're going to look at the intercostal muscles. So intercostal means in between rib. And you can see that the fibers actually follow the same direction. I'm so sorry, that was my son banging on the window. Where was I? So external intercostals are going to, the fibers are going to follow the same direction as the external obliques did. So again, with that front pocket pointing downward direction, and they're going to be in between all of the ribs. So external intercostals, okay? And then if we remove those, we see the internal intercostals. And again, these are going the opposite direction. So I'm gonna pop the externals back on because now you can see them next to each other. So as we get a bit lower, it's a little harder to tell. On a test, we'll be sure to show you very clear ones that are going perpendicular to one another, okay? So your external intercostals are this direction, your internals are going the opposite direction. Okay. The innermost intercostals are not easy to see in this software, so we've left them off your lab list. But be aware that they are deep to the internal intercostals and the fibers run the same direction as the internal intercostals, but you don't have to worry about that for the lab test. Okay, next up on our list is the diaphragm. So for that, we're going to tip us up this way, and here's our diaphragm. Okay, so there's the central tendon. And then here's the diaphragm itself, okay? So you can see it has attachments all around the bottom of the rib cage down to the lower thoracic vertebrae. And all those muscle fibers are coming up to insert into this central tendon. Okay, so what you end up with is sort of a balloon shaped structure. And the way it's going to work is when you breathe in, it's going to move down. So it's going to kind of flatten down to allow space in the lungs. And then the passive relaxation, it blows back up, moves back up the way you see it here, and the air moves out of the lungs. Okay, so that's our diaphragm. Now we are moving in towards the hip and thigh, slowly but surely. There we go. I think this is where we end today. So let's get rid of all of this. Okay, so we're going to move up just a little, oops, wrong way, just a little bit to start off with. Right here with your iliacus and your psoas major right here. Okay, so psoas major and iliacus are going to join together to make the iliopsoas, which will then insert, hang on, let's get rid of a few things here so we can see the insertion. There we go. So you can see it coming down to insert on the femur. Okay, so iliacus and psoas major. Okay. All right. And since we're right here, let's do some of these anterior thigh muscles. So now we're moving into the thigh. Okay. So we'll start here with sartorius. Okay, you can see going from anterior superior iliac spine, crossing medially to insert on the tibia. Here, let's move this up so you can see it. There we go. Okay, so that's sartorius. And making up most of the anterior thigh is going to be your quadriceps group of muscles. So that's going to include rectus femoris, vastus lateralis, vastus medialis, and you can see all of these are inserting into the quadriceps tendon, okay, which is going across the patella and to the tibial tuberosity. Now there is one more quadricep muscle. Quadriceps means 4, and we've only seen 3. So we'll hide these 3. And then you have one deep muscle right up against the femur, which is vastus intermedius. Okay, same insertion. So we'll get rid of that and sartorius. And now we will have a look at our adductor group. Okay. And actually, let's hide them. Okay, I do want you to look at the adductors with the quadriceps and sartorius there as well, so you can recognize everything. But for this look, we'll just have all the anterior group removed. All right, so most medially we have gracilis, which is a long, skinny muscle. Okay, and you can see it running from the hip past the knee joint and down to the tibia. Okay. Then we'll, oops, there we go. Then we'll go up here to adductor longus. Okay, and you're going to have an adductor longus, adductor brevis, and below is adductor magnus. So let's start with, so there's your adductor longus, okay? We're gonna hide that because the other two are kind of hiding behind it. There's your adductor brevis, brevis meaning short, okay? Hide, and then we have our adductor magnus, okay? And you can see it has a little split here. We haven't gotten too much into it yet, but that's because a number of structures are gonna pass through this opening. Okay, so running from the hip down right along the shaft of the femur and then down at the bottom near the adductor tubercle. Okay, so that's your adductor magnus. And if we go up a little bit, a little more superior, we have pectineus, another one of your adductor muscles. And then coming over here, again, we have our iliopsoas here. All right, so let's move laterally because I want to show you, there we go. the side a little bit. So on the lateral side, we have our iliotibial band and tensor fascia lata. So the tensor fascia latae muscle is here. The actual muscle belly, tensor fascia latae, right here, okay? Oops, coming from anterior superior iliac spine. And it's going to insert into this very large tendinous stretch, which is called the iliotibial tract, okay? Very large. So it's coming all the way down the lateral side past the knee. And it's going to encompass the iliotibial tract, so the big tendinous area, and it's going to serve as an insertion for tensor fascia latae and for the gluteus maximus muscle, okay? And this is why if you've ever had IT band injuries, you know that sometimes it causes you pain up in the hip and sometimes near the knee and sometimes both. And that's because of the very broad scope of this band, okay? Commonly called the iliotibial band as well as the iliotibial tract. All right, let's scoot back here and get a better look at our gluteus maximus. Okay, so again, we have insertion to the iliotibial tract, and then let's get rid of all this so we can see what's underneath. All right, so then deeper, there's your tensor fascia latae, we'll get rid of that. Deep to gluteus maximus, you have your gluteus medius, okay? Now, I want you to note that gluteus medius goes right up to that iliac crest on the posterior side. And the reason that's important is for identification on a test, okay? Or in real life. So your gluteus medius goes just about to the iliac crest. If we reflect that, we see the gluteus minimus deep to it. Now on a test, you won't see both. If gluteus minimus is what the question is on, this is the picture you'll see. Okay, so you have to be able to identify it without the other gluteus muscles present for reference. So gluteus minimus has its origin quite a bit lower, so you will see quite a lot more bone exposed here if you're looking at gluteus minimus. Okay. What's next on my list? Okay, and then we move right to the back, posterior, and look at the hamstring group of muscles. So we'll get rid of a few things here. So there's your gracilis and your adductor magnus. You can also see those from the posterior. We will not label them from the posterior. We will label them from the anterior view on a test. All right, and now what we're left with is our hamstring muscles. So these are going to be your knee flexors, okay? And more importantly, your hip extensors. Oops. Zoom out. Okay, so knee flexion, hip extension. So we'll start laterally. On the lateral side, you have biceps femoris. Biceps femoris has a long head and a short head. Okay, so long head of biceps femoris is here, and the short head is there. If we here, turn this way, we can look at the two medial muscles. So the hamstrings are composed of 3 muscles. And medially we have semitendinosus. So semitendinosus, I remember it because it has a very long, skinny tendon. Okay, and we can't even see the whole thing in this image. There we go. Okay, so you can see the semitendinosus tendon wraps all the way around, almost kind of anteriorly on the tibia, okay? A lot more forward than the other muscles. And that's how it's gonna help with knee flexion. So it's going to pull up on the tibia so that it moves in this direction, okay? And then the last muscle is semimembranosus, which is kind of a chunkier muscle belly and a shorter tendon, also inserting on the tibia. Okay, that's it for today. I hope you enjoyed this lab, and we will see you next time.